hospitals into smart hospitals. Before I tell you about our product, I'd like to share a quick story. This is my Tavia. He was my superhero. 5 years ago, he got checked into a local hospital. Go back. There you go. Thank you. 5 years ago, he got checked into a local hospital for COPD. Like most patients, he started off in the ICU, where he was getting high quality care. And then he got checked into the private patient room, where most of us were pretty excited that he got out. But what you don't realize is that the standard of care outside of the ICU is pretty basic. You have a nurse that goes around every few hours that manually checks on the patient's status. This is a typical patient chart that a nurse is filling out. Every few hours, a nurse will go around, manually collect a vital sign, and put this out on a plot, and this plot is given to the doctors at the end of the day. Doctors have a really tough time. They have to make really tough decisions off of very little data. Is this patient getting better, or is this patient getting worse? Is the treatment working, or does the treatment need to be altered? And can this patient go home, or does this patient need escalated care? These questions plagued my grandfather because his condition worsened overnight and nobody noticed. Not the doctors, not the nurses, not even us in the same room. The next morning, they checked on his condition and rushed him into the ICU for the last time. What we set out to build, which I would love to show you, if I can change my slides. Can someone help me out? Yeah. One more time. So this was really the genesis of Stasis. What we set out to build was trying to figure out how do we take this patient chart and convert it into something much more dynamic and high resolution, allowing doctors to make proactive decisions rather than reactive ones after we see symptoms. You can see in this chart, it's much easier to tell if the patient's actually destabilizing over time, not just looking somewhere in the middle. So how do we do this? We built a three-part system called the Stasis Monitoring System. This includes the Stasis Monitor, which is this box that you see, which sits at the bedside and automates data collection. We have the Stasis Tablet, which is a nursing station tablet that digitizes the whole patient chart. And we have the Stasis mobile app, which allows doctors to communicate remotely about their patient's condition. Let me walk you through how this works. The Stasis Monitor is simple and elegant. These 6 icons represent the 6 different vitals that we measure that are required for any patient across the care continuum. If the colors are green, the vitals are within the range set by the doctor. The icon turns yellow, you can call a nurse. Simple for elderly or children to understand and be part of the clinical pathway. The Stasis tablet sits at the nursing station and centralizes all these Stasis monitors. So you can see on the left, we have all the ability to see the live waveforms and numbers, even without being in the patient room, giving them their privacy. But at the same time, every 5 minutes, our system is automatically logging these patients' vital signs and documenting them in high-resolution trends, as you see in the long-term trends. This allows doctors to make those proactive decisions without all that manual effort. And lastly, we have the Stasis mobile app. The app allows doctors from anywhere at any time to know how their patients are doing. And we believe in giving insights, not just data. You can look at this graph and tell the stable patient versus non-stable patient. In seconds, a doctor can do a round of all his patients across the hospital. So far, we've implemented in over 15 hospitals across Bangalore, Mumbai, and Chennai. We're expanding pan-India and mostly have coverage in private patient rooms all the way to emergency ICUs and surgical ICUs. Our hospital partners are excited because we're allowing them to reduce their nursing costs. We're giving them a better patient experience, and we're optimizing their productivity by reducing their length of stay. And we're doing all of this with zero capital expense. The last part of a smart hospital is that a smart hospital has to keep upgrading. You can't just buy one product and be smart. So today I want to introduce our latest feature that's coming out in our winter update. Our updates go to all of our customers, get wirelessly pushed over the cloud. Stasis Pro is for your high-risk cardiac patients, where you'll be able to actually see the ECG and plethysmograph and live waveforms from anywhere from the comfort of your phone, allowing for even higher-risk patients to be monitored on Stasis. If you guys would like a demo, please go outside after this panel and we'll be on the right side. Thank you guys.
Before we resume the discussion,